Your loved one suddenly can't smile properly, but you hesitate. Is it serious? Or just a weird moment? 60 seconds later, they collapse, and it's too late. Every year in the U.S., stroke strikes nearly 800,000 people, and many of them could have been saved or spared permanent damage if someone nearby had acted just 1 minute earlier. But most people don't recognize the signs. That's why the FAST method exists, to help everyday Americans spot a stroke in less than 60 seconds and save a life. In this video, you'll learn exactly how to use fast face, arm, speech, and time. I'll break down each step with clear examples, explain why it matters medically, and help you build the confidence to act quickly without second-guessing. So let's dive into the first and perhaps most obvious signal, the face. Let's start with the F in fast face, drooping. When someone is having a stroke, one of the very first and often most visible symptoms is a sudden loss of muscle control in the face. It typically appears on just one side because most strokes affect only one hemisphere of the brain. If you notice that someone's smile suddenly looks lopsided, or that one side of their face appears to droop or sag, especially around the mouth or eye, you may be looking at a stroke in progress. This isn't a gradual change or something that develops over days. It's sudden, often within seconds. And it's not subtle once you know what to look for. Here's how this works in the brain. The facial nerves originate in the brainstem and are controlled by the cerebral cortex. If blood flow is blocked to one side of the brain, say the right hemisphere, the left side of the face may lose tone coordination and control. This is why the stroke signs show up in such an asymmetric way. You might see the corner of the mouth drooping downward while the other side stays normal, or the person might try to smile, but only half their face moves. Sometimes the eye on that same side will appear more closed or lazy, as if they're suddenly very tired. Let's bring this to life with a real story. Maria, a 59-year-old office manager from Texas, was having breakfast with her daughter when her daughter noticed something strange. Maria was smiling at a joke, but the smile looked uneven, like one side of her face just wasn't keeping up. At first, they laughed it off. Maybe she was still waking up. But within a minute, Maria started to mumble her words. Her daughter had just watched a stroke awareness segment the week before, and she remembered the word fast. She immediately told her mom to try smiling again. When the smile came out lopsided a second time, she called 911 without hesitation. Maria had suffered a mild ischemic stroke. Thanks to her daughter's quick action, she received clot-busting medication at the hospital within the critical 3-hour window and made a near-full recovery. That's why this step is so crucial. If you suspect something's off, ask the person to smile. You don't need a medical degree to see asymmetry. Trust your eyes. If one side doesn't move like the other, or if the entire expression looks off, don't second-guess. This isn't about waiting to see if it improves. It's about acting in the moment, because with stroke, every minute counts. For every minute a stroke is untreated, nearly 2 million brain cells can die. Now, while the face may show the most obvious clues, the arms can reveal what's happening deeper inside the brain. Let's move to the second part of the FAST method, arm weakness, and how it can show up in ways you might not expect. The next letter in the FAST method is A for arm weakness. Just like with facial drooping, arm weakness during a stroke usually happens on one side of the body, depending on which side of the brain is affected. The key difference is that it's often easier to test and recognize, especially if you know what to look for. When someone is experiencing a stroke, the part of the brain that controls motor movement specifically, the primary motor cortex, may be deprived of oxygen. That loss of oxygen interferes with the brain's ability to send signals to muscles. The result? One arm may become suddenly weak, numb, or even paralyzed. Sometimes the person doesn't feel it immediately. They may only notice that their hand feels heavy or they're unable to grip objects the way they normally would. Other times, they may try to move their arm, but it doesn't respond, or they may not even realize it's limp unless someone points it out. A simple test you can do is ask the person to raise both arms in front of them, palms up, and hold them there for 10 seconds. If one arm drifts downward, or if they can't lift one arm at all, that's a red flag for a stroke. This is known as arm drift, and it's one of the most reliable signs of motor function breakdown due to a stroke. Let me give you a real-life story to make this more concrete. Joe, a 72-year-old veteran living in Florida, was raking leaves in his backyard when his wife noticed something strange. He dropped the rake and started shaking out his left hand like it had fallen asleep. When she asked him what was wrong, he shrugged and said, "I think I pulled something." But when she asked him to raise both arms, only his right arm went up. The left one stayed at his side. She remembered seeing a FAST poster at their community health center and immediately called emergency services. Joe had suffered a mild stroke affecting the right side of his brain. Thanks to her awareness, he received early treatment and avoided long-term disability. One important thing to understand is that arm weakness doesn't always mean complete paralysis. It might start subtly, like difficulty buttoning a shirt, holding a fork, or carrying a grocery bag. That's why context matters. If the weakness appears suddenly, and especially if it affects just one arm, it should never be ignored. It's also often accompanied by numbness or tingling, which can make people mistake it for a pinched nerve or poor sleeping position. But a pinched nerve doesn't typically affect both strength and coordination in such an acute way. Remember, this isn't about diagnosing someone with certainty. Your role is to observe, recognize something isn't right, and act quickly. Asking someone to raise their arms is fast, simple, and incredibly effective, and it can be done by anyone anywhere, whether you're at home, at church, at the gym, or in the middle of a grocery store aisle. So now you've learned how to recognize sudden facial drooping and arm weakness, two key physical signs that someone may be in the middle of a stroke. But the next clue can be even more unsettling because it directly affects how a person communicates. Let's talk about what happens when a stroke impacts a person's ability to speak or understand words. The third letter in FAST stands for S, speech difficulty, and this one might be the most jarring of all. Imagine talking to someone you've known your whole life, and suddenly they can't finish a sentence, or the words coming out just don't make sense. Maybe their speech is slurred, or they're using the wrong words entirely. This change doesn't come from tiredness or distraction. It's often a direct signal that the brain is in distress. Speech is primarily managed by two areas in the brain: Broca's area, which controls speech production, and Wernicke's area, which manages language comprehension. A stroke affecting either of these regions, usually in the left hemisphere of the brain, can result in different kinds of speech impairment, collectively known as aphasia. The person might slur their words like they're intoxicated, mix up common phrases, or lose the ability to form coherent sentences altogether. Some may understand what's being said, but can't respond clearly. Others might not understand language at all. Let's talk about a real case. Nancy, a 64-year-old school counselor from Oregon, was talking on the phone with her sister one morning when she suddenly started speaking gibberish. Her sister initially thought the line was breaking up, but then Nancy repeated the same phrase twice. I'm Waterhand's clock. Those were not the words she intended to say. Her sister, alarmed, called her husband at home. When he went to check on Nancy, he found her staring blankly, unable to form complete sentences. He called 911 immediately, and doctors confirmed a stroke had affected the left side of her brain near Broca's area. Thanks to her family's fast response, she began speech therapy within 48 hours and made excellent progress in recovery. Here's how you can test for stroke-related speech problems in an emergency. Ask the person to repeat a simple sentence like, "Today is a sunny day," or "My name is John." If they slur, can't finish the sentence, use the wrong words, or appear confused, don't assume they're tired or joking. If their speech was normal minutes ago and suddenly it's not, that's a clear neurological alarm bell. It's important to note that many people having a stroke don't even realize their speech is impaired. That's why it's so crucial for the people around them, family members, co-workers, or even strangers, to recognize the signs. In fact, speech difficulty is one of the most commonly missed early symptoms of stroke, simply because it's often attributed to stress medication or even just not being awake yet. One more tip. If you're unsure whether it's speech-related, watch their facial expression as they try to talk. Do they look frustrated or surprised at their own words? That can be another strong clue that their brain is misfiring, not their emotions. You've now learned 3 of the 4 core FAST indicators: face, drooping arm weakness, and speech difficulty. Each one is serious on its own, but when you see 2 or more together, it's a medical emergency. So what do you do next? That leads us to the final most urgent letter in FAST T time to call 911. The final letter in FAST is T, and it stands for the most critical action of all time to call 911, because when it comes to stroke, time lost is brain lost. You now know how to spot a stroke face, drooping arm, weakness speech, difficulty, but recognizing the signs is only half the battle. The other half is what you do next. And what you do in the first 60 seconds after noticing symptoms could mean the difference between full recovery, lifelong disability, or even death. That's why time in the FAST method isn't just about being aware of the clock. It's about taking immediate action without hesitation. Let's break this down. When a person is having an ischemic stroke, the most common type caused by a blood clot blocking a vessel in the brain, there's a limited window of time to receive a clot-busting medication called TPA tissue plasminogen activator. This medication can dissolve the clot and restore blood flow, but only if it's given within 3 to 4.5 hours from the onset of symptoms. The sooner it's given, the more brain tissue can be saved. Every minute that treatment is delayed means up to 2 million brain cells could be dying. So even if you're not sure, you should never wait and see. Here's a real-world example. Mark, a 67-year-old retired firefighter from Michigan, was watching TV when his wife noticed something strange. He dropped the remote and looked confused. When she asked what was wrong, his speech came out slurred, and one side of his face drooped. She remembered the FAST method from a health fair they had attended. Instead of trying to drive him to the hospital or waiting for it to clear up, she immediately called 911. Paramedics arrived within 10 minutes and alerted the stroke team at the nearest hospital on their way. Because of her quick call, Mark received a CT scan and TPA just under 1 hour from symptom onset and walked out of the hospital a week later with no major deficits. This is exactly why calling 911 is the only correct move. Driving yourself or having someone else drive you may waste valuable time, and most importantly, EMS professionals can begin critical care during transport. They're trained to assess stroke symptoms, initiate oxygen, monitor vitals, and alert the hospital, so stroke specialists are ready upon arrival. That alone can shave precious minutes off the time to treatment. Another key reason to call 911: documentation. Emergency responders note the time of symptom onset, which is essential in determining whether a patient qualifies for certain stroke treatments. If you don't call, or if no one keeps track of the time, doctors may be forced to withhold life-saving therapy due to uncertainty. So as soon as you notice FAST symptoms, take mental note or write down the time you saw the first sign. Here's the bottom line. You don't need to be 100% sure to act. Stroke symptoms don't have to be dramatic or involve collapse. If you see one-sided facial drooping, arm weakness, or speech issues, even if they're mild, act fast. It's always better to have medical professionals say it was just a scare than to wish you'd acted sooner. Now that we've gone through face-arm speech and time, there's one more piece of the puzzle left: what to do after the emergency response begins and how to prepare yourself and your family for the unexpected. You've called 911. Paramedics are on the way. But what happens next? And what should you be ready for if you're with someone who's having a stroke, or if it's you? While the FAST method helps you spot a stroke in 60 seconds, what you do after that can shape the entire outcome. Once emergency services are activated, your job shifts from identifying the signs to helping responders act efficiently. If you're with someone experiencing stroke symptoms, the most important thing you can do while waiting is stay calm, keep the person comfortable, and make sure they don't eat or drink anything. Swallowing can be impaired during a stroke, and even a sip of water can become dangerous if the swallowing reflex is compromised. If possible, gather any medications the person is taking and note any recent head injuries, surgeries, or medical conditions, especially if they're on blood thinners. Also, write down the time when the symptoms first began or when the person was last seen normal. This timestamp is critical for doctors to determine eligibility for clot-dissolving medications or other treatments like mechanical thrombectomy. Let me tell you about Evelyn, a 74-year-old widow from Colorado who was home alone when she experienced sudden dizziness, facial drooping, and confusion. She pressed her medical alert button and was connected to emergency dispatchers immediately. But what made a big difference wasn't just the fast response, it was that her neighbor who had a spare key met the paramedics at the door with a list of Evelyn's medications and medical history, including the fact that she was on warfarin, a common blood thinner. That detail changed the treatment plan and helped doctors avoid complications once she reached the ER. Evelyn later told her daughter that the stroke was terrifying, but what calmed her most was knowing that someone around her knew what to do. If you're the one having the stroke and you're still conscious, try to stay still and avoid standing or walking. Keep your head slightly elevated. Breathe slowly and speak only if necessary. Every ounce of energy your brain uses matters. You don't need to explain everything to the paramedics they're trained to assess without lengthy back and forth. Just focus on staying safe and letting them work. It's also important to understand that not all hospitals are stroke-ready. Many areas in the U.S. now have primary stroke centers or comprehensive stroke centers with specialized teams that can handle complex cases. Paramedics are trained to route patients to these centers when appropriate, which is another reason to avoid driving yourself. Stroke care is a team effort, and the earlier the team is activated, the more treatment options are available. After the emergency phase, there's recovery and prevention, but that's a story for another day. For now, what matters most is this: know the fast signs, act immediately, and prepare those around you to do the same. Because stroke can strike anyone, anywhere, at any time. And sometimes the person you save won't be a stranger. It'll be your spouse, your parent, your best friend, or even yourself. You now understand how to recognize stroke in under a minute. But let's take one more moment to bring everything together and talk about how you can use this knowledge starting today. You now have the tools to recognize a stroke in just 60 seconds. The FAST method. Face-Arms Speech Time is more than an acronym. It's a life-saving checklist that gives ordinary people the power to act in extraordinary moments. Face drooping, arm weakness, speech difficulty. These are signs that your brain is in trouble. And T reminds you of the most urgent truth of all when it comes to stroke time is everything. Every second matters. The faster you act, the more brain you save. Whether you're with a loved one or a stranger in the grocery store, knowing how to spot the signs and call 911 immediately can change someone's future or save their life altogether. So, what can you do now? Share what you've learned. Talk about it at dinner, post it online, teach your kids. Because the person who needs this information next might be right beside you when a stroke strikes. If you found this video helpful, please give it a like, subscribe to our channel, and turn on the notification bell so you never miss another health update. Share this video with your family and friends. It might be the most important thing they watch this year. And if you have any questions or stories of your own, leave a comment below. Our team is here to help and will respond as quickly as possible. Thank you for watching. Stay informed, stay calm, and always act fast.